Hello. Um, Good afternoon. Today I have my friend Sekinat Ola.
Alaboko, yeah.
Exactly. So I'm sorry for not pronouncing your name properly, but I have practiced how to pronounce it before coming in. But notwithstanding, today I have a student from my school. Her name is Sekinat. She's currently the research coordinator of my school. She is a third year medical student currently doing her clinical rotations. Um, I want to appreciate Sekinat for finding time coming into my platform to make sure that this platform get to like pass out information out there for people who are willing to begin their medical journey, their medical school journey towards becoming a doctor. So today we'll be looking at the journey of being a medical student from the perspective of Sekinat, who is a third year medical student with Avalon. So, Sekinat, if you don't mind, can you please introduce yourself to us, like your name and your level of medical study?
Okay. Thank you for the introduction and thank you for having me here. My name is Sekinat Olaboko. I'm a third year medical student and I'm doing my clinical rotations in West Virginia currently. I'm a student of Avalon, as you said.
Yeah.
Yeah.
So it's obvious that you're done with your basic sciences, right? What course would you consider during your basic sciences now? What course would you consider to be like your most favorite course?
Okay. So I'll say anatomy and pharmacology. Anatomy because actually both of them because they are conceptual and like once you understand what the system or the topic is about, you know it. It's either you know it or you don't know it
I
inside it.
don't know.
So you don't have to you also have to know about the application, right? But it's you can't really get them twisted. And
Yeah.
I kind of consider myself a visual learner. So I it's easier to kind of picturize anatomy and
Mhm.
pharmacology a little bit.
Yeah.
Yeah,
Yeah.
so I'll say both of them. And we had great teachers. For
Yeah.
pharmacology, Dr. Bala was really, really helpful. He
Yeah.
had our pre-recorded videos before classes, and the way she simplified like a lot of the concepts made pharmacology like very interesting. And anatomy, Dr. Owosu, shout out to Dr. Owosu. To now, even in
Yeah.
to like sometimes I see like some of the concepts that he explained back then in basic science. I'm like,
Hmm.
Dr. Owosu,
Honestly.
yeah,
I mean, I also had the same experience. Like, I think if you ask me, not to downplay the role of other professors, but I would
yeah,
say Dr. Wosu and Dr. Bala. Dr.
yeah,
Bala was one of my favorites, and Dr. Wosu was also up there. And
yeah,
also, someone like Dr. Lambo also simplified the
yeah,
aspect of evidence-based medicine and the rest. So, like for me too, anatomy is like one of my best course. Then anatomy and pharmacology, like you mentioned. My reason is I can easily predict my score. Honestly, it's like straight to the point. If you have ulnar nerve injury, it is ulnar.
yeah. You
It
know what it
presents
presents
the
with?
same.
Yeah,
It presents the same in all patients.
yeah,
Ulnar nerve injury presents the same way in all patients, the same
mm,
weakness, the same numbness, the same
yeah,
area of distribution. Same with what is it called, pharmacology, the same
yeah.
effect.
Mechanism
So
of action is not changing. And all of
exactly. So you don't fall into this situation where you have to change your answer due to doubt
uncertainty. Yeah.
and uncertainty, and that leads you to like losing a point in the test. So I would honestly, I would like to shout out to these professors, Dr. Bala, Dr. Mosu, for the immense effort they put in to make it like very easier for us. Dr. Bala also simplified it for us, like she would ease you into the whole process while preparing your mind.
That is
We
not
have, it's
easy.
not easy. She will tell you, yo, this is pharmacology.
Yeah.
This is pharmacology. Don't mess with it. You just have to study it.
Mhm.
There was a day, it's like, is there a way? Say, I'm sorry, you just have to,
Yeah, you just have to, there's a lot of memorization.
you
Those
just have to
pharmacology
memorize it.
drugs.
Yeah, especially the names, you just have to
Mhm.
memorize. The most confusing ones are the medication for treat and the different psychiatric medications,
Mm.
because some of them the negative effect can become a positive effect for a particular patient. The side
Mhm.
effect can be used as a positive effect
Yeah.
for, I mean, that makes it even more complicated. But at the end of the day, you just have to like memorize all those things and
Mhm.
when it is applicable to use them.
Yeah.
So
I feel like Dr. Pravin was also like he made physiology kind of easy for me.
easy
I
to,
really liked him.
yeah,
But the problem is physiology, not in like physiology is very, very broad. I feel like it encompasses pharmacology, pathology, like everything
everything, yeah.
together. Yeah.
Yeah, not to say, I mean, Dr. Pravin, he did a good work. He did a
Mhm.
good work while also teaching physiology. I mean, I believe physiology itself, man,
Yeah.
physiology is like, what would I call it? It's a different specialty on its own. Like people study it as what would I call it?
As a
Undergrad
course.
course on
Yeah.
its own.
Mhm.
And
Mhm.
how do
Now
you
compressing it into
now
like
compress it
semester
two
work.
semester
Yeah.
work? I'm like, but there was this idea he initiated during our time where he gives us like at the end of the day he gives us like maybe 10 practice questions. It is mandatory that you practice those questions and turn it in.
Okay.
He does not he does not score he does not score the test, but if you don't do it, he will subtract mark from your end of semester score. So it's like he is building this what we call the culture of at least practicing 10 questions a day,
Yeah.
reviewing the concept and all those. I mean, when we started it, most of us were failing it, but along the line, we picked up and we're
Yeah.
doing great. I mean,
Yeah.
I would like to shout out to him too. I mean, Dr. Praveen, wherever you are, thank you very much for helping us understand physiology. So, has there been a situation or a time when you faced a logistical challenges towards your study? When I mean, like your travel document, like your visas, trying to pay your school fees, like if you had such experience, how were you able to navigate?
Okay. So, for let's start with the visas
Yeah,
to the island. So, we needed landing permits initially.
yeah.
We had to send our documents or IO fees then. But that one, the problem was it was not really a problem after I got all my documentations, like Sharissa handled everything. But for the visa itself to enter Curacao, there was like a kind of hurdle because we didn't have the Netherlands embassy in Nigeria. So we either had to go to Ghana or go to Cotonou. And for me, like the time I needed to apply for the visa, I didn't find any appointment in Cotonou. The appointment I was in for was like for 3 months or 4 months after, and it would be too late for me to resume school.
Hmm.
So I had to check Ghana, and the appointments were like fluctuating, coming and going. So I had to stay up at night on most days to check the appointment availabilities. And when I eventually found an appointment, I could not pay for it because I was in Nigeria. So I had to travel to Ghana first, even though I wasn't sure I was going to find an appointment. But then I had to, after I got an appointment, I had to use like a card, like a Ghanaian card to pay for
Hmm.
it. But after then, I went for the visa submission. Every other thing was seamless. So it was mainly the appointment, getting the appointment that was the main issue. But other than that, I didn't really face any issue. And then with payment of fees, shout out to Nigeria.
Nigeria.
Shout out to
Nigeria is always
Nigeria.
Nigeria.
Yeah, after us, the exchange rate has been
Ah,
unstable, and the way it even skyrocketed from like 700 and something to like over almost 2K, like
oh,
1,700, or what is it now?
wait, when you started, what
Crazy.
was the exchange rate?
Like when I signed Avalon,
Yeah,
I started 2023, so it was like maybe 700 or 750 thereabout.
I started when we were exchanging at 1,300 and no, 1,000. No, it was around 145 dollars.
$145. No,
So
145 naira to $1,
to
right?
$1,
Mm-hmm.
145 to $1. That was nice. That's to tell you how I have made different
Yeah,
cycles of
that's
exchange
like one
rates.
thousand percent increment.
Honestly.
Mm-hmm.
So I mean, I faced the same situation. I mean, when I went to apply for my visa, I went to the embassy in Nigeria. That was 2019. So we went to the embassy. We were told that, oh, the Netherlands embassy has been moved to Ghana.
Yeah.
I had no idea the reason why it was that way. Then, being that I have no student, like no knowledge of any Avalon students that would have helped me to ease my path towards the whole process, I had to travel to Ghana, did the
Mm-hmm.
same thing that the same process
Yeah.
you follow. That was what I did too. But I think my saving grace there was I already had a domiciliary account, and
Mm-hmm.
that helped me with navigating
Payment.
payments and everything. And I think there's a Zenith Bank branch
Okay. In
in
Ghana, yeah.
Ghana, yeah. So I
Mm-hmm.
was operating with Zenith Bank back in Nigeria, and my domiciliary account was with Zenith Bank. So when I went to Ghana, I just went straight to their, what is it called? I went straight to their branch. I explained my situation. They asked me, "Do you have a domiciliary account and a card?" I'm like, "Yeah." So they requested for it. So it helped me to withdraw money, and they exchanged it for me. I withdrew in dollar, and they changed it for me in cedis, and that
Yeah.
was how I paid for my visa. And again, I think Avalon played a huge role in making sure that the whole process was eased, was very, very easy and simplified. I mean, they did their best. You cannot blame them for the whole absence of
Embassy
Netherlands
in
visa in
Nigeria.
Nigeria. Yeah, but the aspect where you have to like turn in documents and you get it at a specific time, then even your landing permit, they will tell you get your landing permit after 12 weeks. And after 12, you get your landing permit.
My
So
own was
that,
delayed though.
why?
I had no idea. So they said they had a lot of applications when I applied. So
Oh,
maybe that's why.
okay.
It was delayed for like extra maybe 2 months or something before I got it
Oh, okay. I mean, mine was considerably within the
on
time
time.
frame. Yeah, because whenever they tell me to turn in documents, I make sure I provide the document as soon as possible.
Yeah.
So they kind of start processing, and then there was already this whole process of changing governance between the Goodluck administration and what is it called, the Buhari administration. So I think that was when Buhari was vying for his second term or something
Okay.
like that. That was when he was vying for his second term. So there was this election coming up. So I was like trying to beat the whole second term thing because I mean there are certain policies that could be promulgated that
Yeah.
could affect the whole process.
Yeah.
So my thought process is okay, let me just beat this whole situation, get out before the whole new administration, like per se, even if he was the incumbent president, it's still a
Yeah.
new administration. So that was how I navigated the whole visa thing. And Avalon had a huge role to play. I mean, shout out to Jackie, shout out to Sarah, shout out to Rachel.
There
And
was Hannah Childs, but I think she
yeah, shout out to them because they're always like on it.
and
They're always
Tara
on
too,
it.
Tara Santiago, yeah.
Yeah, the interesting part is the speed at which they reply your message.
Yeah,
Being
they
that,
reply early, yeah.
yeah, you're not within a space where they can easily reach out to you. So immediately they get your email, I think they make it a priority to reply you as soon as possible. I
Yeah.
would like to shout out all the administrative arm of the Avalon University. I mean, they've been doing their best. There's
Yeah.
nothing we can do about the location of Netherlands embassy in Ghana rather than Nigeria. That is beyond them. So, looking back at your journey as a medical student, right? What could you have done differently to make the path smooth and even
I'll
easier?
say I'll say I was stressless
Okay.
because I starting when I started in Avalon, it was kind of difficult for me to adapt to the test taking system in Avalon and maybe the classes as well. Because
Yeah.
the way they ask the questions like the sycamore, no, what's that thing called again?
What is
I've
it called?
forgotten.
Forgetting the platform where we take our exams,
The
right?
software, yeah.
The software, yeah.
So like the questions were like QSMLE style questions, and
Mm-hmm.
like the system I came with was like totally different from that. I didn't do pre-med in Avalon, so
Yeah.
like just entering that was kind of difficult for me. So I was really anxious for a lot of my tests, a lot of my quizzes. I was really stressed. I'll fall
Hmm.
sick every morning before Praveen quizzes. And get better after the after the exams. So I was really stressed. But after a while, I feel like I adapted to it, and it's not like I'm still not stressed. Like that's medical school. Like it
Yeah.
comes, it's like a
Comes
package.
with it comes
But
a
you just
package.
have to I calm myself down more. Like it is what it is. Just study, pray, work hard, practice as much questions as you can, and
Hmm.
just hope for the best. So
Yeah.
I'll say, yeah, definitely I'll like stress less, and I would maybe try to find a resource that works for me
Yeah.
earlier on in the journey. Because you meet some people, they'll tell you, oh, Ambos is better, no, this is better, that is better. And you know, using multiple resources, I mean, I don't know, it works for some people, but like majority of the people get confused
Yeah.
jumping from resource to resource. So
Hmm.
I think that's definitely, and talking to too much people,
Ah.
like that can,
So
you
they can.
you meet some students, some of them are just, I won't say naturally unserious or maybe pessimistic. They'll just tell you, Praveen's quizzes, you can't pass it. But it's not true.
It's not true now.
You know, like, have you met people like that? They'll tell you,
Yeah,
like,
I've met people who tell you that, yo, this person is
difficult,
just
you
so
can't do
difficult.
this, you can't do
Hmm.
that, before you can pass so quiz is hard. So it's like they're already even putting you down before you actually experience it yourself. So
Wow.
I would say, like, definitely, sometimes talking to people, maybe talk to people, but kind of filter the information you get from
You get
them.
from it.
Not
Yeah.
that they'll tell you, don't even bother studying because you can't pass. It's now go and sleep and not study.
Yeah.
Yeah.
So apparently, so your advice is do not listen to everybody. Just
I mean,
listen to a few.
hear what they have to say, but filter the information you get from them.
Okay. Sekinat say filter the information you get from your older students, because sometimes you tend to have information that will like
Yeah.
deter you or kind of weigh you down or kind of even make you feel very, very low about the whole process. So filter whatever you hear from anybody when you're looking for an advice on how to navigate certain courses like physiology, anatomy, and all those. And be optimistic.
Be optimistic.
Be
I feel like
optimistic.
Christabel was that one for me because I didn't, when you just get to a new place, you'll be looking for people to talk to. But like
Mhm.
one, Christabel is like, no, you can do it. Don't let anybody tell you cannot get 80 something on that quiz or 90 something on that quiz. Just study for it. You can do it. I'm like,
Yeah.
okay. Okay. And sometimes that's just all you need. Like someone telling you, it's beans, don't worry, you make it. So yeah.
Okay. Okay. So don't listen, be optimistic. Listen and filter
Listen and filter.
and be optimistic. So have you chosen a specialty in mind? You're
I'm
almost there. Oh. You're almost there.
It's like it's almost there. There's still time. Oh. I'm still,
Just
I'm
be there.
still, you're not totally there yet. There's still time. I'm still evaluating. I'm leaning more towards Obigani. Like it's piquing my interest at the moment, but it's kind of competitive for visa requiring IMGs. So
Mhm.
I'm still, you know, I like it. It's something I like to do. I like that it combines surgical and primary care,
Yeah.
psych, everything together for women.
Hmm.
But at the same time, you have to apply smart, right? So
Yeah.
I've
You're looking into it.
I'm looking into it, yeah. But I like IM as well. I
Oh,
like IM. I think I don't know. I don't really want a specialty where it's just stereotypic. All you have to do is just sit down, talk to patients, and that's it. Like I
yeah.
don't.
You want to be involved,
Yeah, I
like
want to work. I want to
deeply
be
involved.
active. Yeah,
The adrenaline rushing up and down.
exactly. So
So, I mean, for me too, like initially when I started the whole process, I was like, before I applied, I wanted to
mm.
be a pediatrician. When I
Oh,
started, before I applied, I wanted to be a pediatrician. when I started basic medicine, I
Mm-hmm.
switched to orthopedic
Also,
surgery.
mm-hmm. But now,
Later on, down the line, when I looked at the whole programs for IMG, programs that are IMG friendly and all those things, I just, most of them are like 100% not in favor of IMGs.
yeah,
That kind of started impacting on my, I wouldn't say my dream, my
yeah.
choice. It impacted on my choice. Now, leaning towards probably general surgery or emergency, but I still have these two in mind.
Mm-hmm.
Notwithstanding, if you ask me to play some kind of place them in
All
a
right. Mm-hmm.
yeah, like in a, if I'm to distribute them in a area of let me say from the highest to the lowest, which of them will be my top choice? I will go with general surgery, then second emergency surgery, emergency medicine,
Medicine.
then the last one will probably be internal medicine. But
Mm-hmm.
notwithstanding, those are like my top choice. But oh God, I keep praying. Oh
Yeah.
Lord, make it easier. Make it
Mm-hmm.
easier. It's not easy. After all this process, you have something. I would say it's not fair. You put in the work, you have the score, and the only thing limiting you is just the logistics. Like
Yeah, IMG, yeah.
ah, it's unfair. And some of us are not. I mean, some persons are not even given the opportunity to like showcase their art. You don't
Mm-hmm.
have the opportunity to prove what you can do and what you.
Yeah.
I mean, we have a lot of talented IMGs out there,
Mm-hmm.
talented IMG for some field, but they set. I wouldn't say set to. They pick other. Let me say they pick other specialty based off of the fact that this is what is open to them and this
Yeah.
is what they can
Yeah.
reach. So, as a medical student, you're familiar with different study materials and all that, right? Which of them would you recommend to somebody beginning this whole process?
Okay. So for content, I would say first aid. But with first aid, you have to, because first aid is like a summary. So you have to have like a bigger textbook for maybe anatomy, path, and all of that to learn the content well. The first aid kind of summarizes everything you need to know for your exams. And then
Yeah.
Pathoma is actually really good for pathology, Pathoma videos and book as well. Then
Mm-hmm.
for questions, I would say U-word. U-word is the G. Is the G is like
Is the father
everything
of them
you need to
all?
know is in U-word. As long as you understand the concept, U-word is really good. Amboss too. I've had people like friends who used Amboss and it worked for them. But Amboss is like for like tell people
Tough
like
topic.
you
Like
need more information that is not for general people like
honestly,
us. So, but Amboss is good too.
Ambos is good.
Yeah.
Okay. So for me too, like I started with US Emily RX.
Mm-hmm. Yeah.
Dr. Praveen exposed us to it. But the school provided us with lecture. These are like other materials that some persons might not have a knowledge of. Then
Mm-hmm.
my school exposed us to lecturio. Dr. Praveen started exposing us to
All
US
right.
Emily RX. Then down the line, I picked a certain love for U World, and since then I've been a fan of U World. I
Yeah.
do amboss once in a while. That is, if I've gone through like 80 or 90% of the whole questions from
Yeah.
U World. That is when I tend to like augment with amboss to pick out those nuances that are not
Yeah.
reflected in U World,
Good.
so as to like cover them too. So that was I mean, that has been like my study plan so
Mm.
far. I mean, has it been working for me? Yes. Have I been getting like a perfect score? No. But it's getting me down, like it's helping me navigate through the process. Let me just be honest.
Mm-hmm.
So if you have an opportunity to shout out to anybody who has been of an assistance to you towards this whole journey, who would that be?
Maybe my family.
Really,
My
nothing
siblings and my
super family.
parents. Honestly, like they are the G's from like day one. like supporting financially, times
Yeah.
call them, lament to them, this was going on and everything. So they've been like a solid support for me, and yeah, I really appreciate them.
Yeah, me too. I'll just shout out to them. Like I always, when I wake up every morning, I always thank God for my family too. I mean,
Yeah,
they've been like a huge solid drop throughout this process. Sometimes they're even like very, very patient with you. They want to talk to you. The
yeah,
moment you tell them that, man, I
I'm
have to
studying.
study,
Mhm.
they will just suspend it, irrespective of how they feel at that
Important,
moment and how important it is. And my mom will be like, stop disturbing him. Stop
yeah.
calling him. Why are you guys
Yeah, let
calling
us
him?
study. He's a
Let him
doctor.
study. You understand? So you have these people like they are behind you doing. I mean, at the end of the day, right, when you graduate, you'll be the one wearing the sash and everything, right?
Yeah,
But there is this sect of people whose impact
yeah,
are so it is neglect. I mean, they are very impactful, but
hmm,
out there they are not that visible.
yeah.
We would have broken down so many times, like to the extent
Honestly,
that we cannot be like fixed. But
hmm,
because these people are with us, we tend to like navigate it. And yet, most of them do not receive
they
the
are close.
amount of accolade they
Hmm.
need to and the amount of shout out they need to, even from the general public. Tomorrow, when we graduate, people celebrate with us, our families celebrate with us. Oh, Dr. Sekina, Dr. Tony, and everything, right? That's where it ends. I mean, at least I want to use this opportunity, like use this platform to also like reach out to them so people know that people are
It's
doing a lot in
not
the
like
background.
yeah,
Oh, there are people that are going to this medical school with us
yeah.
without actually being in the class.
Hmm.
There was a day my mom would be like, hey, there's this person, there's this woman in her neighbor. She came to the house. She said she was having pains. Do you know what that woman is doing for you? She's helping you review your different pathology of the stomach. Because if the patient is having like abdominal pain and you ask your mom which location,
Yeah.
and the person is telling you right upper quadrant, like the right side. I mean, he is giving you a clue. Now you're reviewing the concept instead. Okay, what are the causes of pain at the right upper quadrant location of the abdomen? That's another way to review. I mean, subconsciously, they might not even know that they are helping you review.
Yeah, revise. Hmm.
Then the moment you start wrapping your head around, okay, what could have caused the pain that this elderly lady is having back home, you don't see her, like this, like another way of doing telemedicine. And like, mom, I'm not licensed to do any of these things.
Honestly.
And she'll be like, I know, but at least give us an idea so
Give
that
us an idea. Hmm.
when we go to the doctor, we know what we should be expecting. I'm like, mommy, the only thing I know is that the liver is at that location.
Hmm.
So probably if anything is happening, there should be some kind of a lab to check and see, you understand?
Hmm.
But the major thing is go to the hospital. We are not
That's it.
licensed to just go
Yeah.
immediately. So it's not something you just sit and just overlook it.
My mom has even written all my exams, even though she's not physically writing it, and she has written it with me, because she's always worried too. Sometimes when I call her and I'm like, I'm passed, she's like, oh my god, like it's a relief on her. It's like she's writing it, like she's also stressed with me.
Honestly.
So we are not going through the journey alone. Like it's not even possible. Like it's with their support, their prayers, their constant motivations. Like these
Mhm.
are the things that keep us going.
When you
Friends
are
too.
when you are anxious, they are anxious. When you're relieved,
Honestly,
they are
honestly, are
relieved.
relieved. There are even
Eh,
sometimes that we are relieved, but they are not relieved.
relieved,
They are
yes.
they are paying tuition. You don't have to worry about paying the
My
tuition.
dear,
Like,
my dear.
uh,
Oh God. Sometimes all we can do is just pray to God for their longevity, so they just get to reap. I mean, they say this whole black tax thing there for my family. There's nothing like black tax. I mean, they end every part of it. And the
what's black tax?
black tax is like when probably somebody from your family is like requesting some kind of financial assistance from you.
Okay, okay.
So like for us now, for me, I don't consider all those things black because I mean they have impacted in my life.
Mm-hmm.
The impact they've made is beyond monetization. Let me be
Yeah,
honest.
yeah, yeah.
So now let's step away from the aspect of medicine, social life. If you had an opportunity of having an all-paid expense trip, where would you like to visit?
Are you paying for it?
Hey, I wish.
It's
I
not a
wish.
issue. If you're
Somebody should,
asking me,
okay, at this point, please, somebody should drop something for our dear sister to visit wherever she wants to visit. I mean, you never can tell. Somebody might look at this thing and like pick interest in it. Okay, you want to send
Kenya, I want
Sekinat,
to
oh,
sponsor
paid expenses.
me. So I'll take Kenya. Like there was actually a video I saw about Nairobi that I fell in love
Oh,
with, and I feel like I've been checking
checking out
that
Nairobi.
videos out, and the Instagram and everything. I just liked the setting. I like dust. It's kind of something weird. So they have this kind of like desert like setting,
Yeah,
love that. So
okay.
maybe
So
Nairobi.
for me though, it's the East Africa too. If I have an opportunity, I would love to visit what is it called? Rwanda and I think Tanzania.
Mm.
So Rwanda and Tanzania, those are the places I would love to visit.
They said they
So
have direct flights from Nigeria to Tanzania. No,
eh,
yeah.
no visa. Because that's another thing now.
I don't know if we actually need visa. I'm not sure. I think we do,
Because
but for Kenya, we no longer need visa for Kenya.
one of the challenges we had then, I've gone to Kenya once, I've been to Nairobi once. The one of the challenges we had then was trying to get a visa.
Mm.
So we're going back and forth with them for the visa and everything, right? And the duration of the visa.
Yeah.
So most times you get like I think mine then was 30 days.
Mm. Okay.
So I mean, if it were to be visa free, man, I'll be exploring.
I
I'll
think
be
it's
exploring.
visa free now. Recently, they made it. I think Nigeria joined the visa free list.
Okay, okay. Then I'll put that in mind. So I mean, you see, if Kenya is visa free, why are we paying for your journey?
No, nah. How am I going to work to Kenya? Is it only visa you're paying for?
Okay. So our sister Sekinat, if anybody wishes to sponsor, like just reach out to me. She
Available.
deserves it too. She deserves it. She's
We
one of
all
the
deserve
nicest soul out there. She she deserves every package that could come from this whole thing. And I'm happy to have this opportunity of speaking to Sekinat, right? I am so happy. So Sekinat, the last question will be right. Um You have Amboss U-Word flashcards Anki.
it. Mhm.
Rearrange them in the order of preference.
First of all, I don't use Anki.
Oh, that number four.
So you said flashcards, UWord,
Yep.
Amboss, Anki. I'll take
Yeah.
UWord, then Amboss, and
U-Word number
then use
one,
flashcards.
Amboss number two. So you don't use flashcards, you don't use Anki.
Not really.
No.
Sometimes, like I've used them occasionally, but they're not like what I use steadily.
Okay. I use Anki. I also make flashcards for myself.
Yeah.
So I also
I think
use U-Word.
yeah. They say it helps with retention and
Repetitive memory. Yeah. Like, I mean, where it helps me is like, clinical presentation.
okay.
Sometimes some of them they tend to look alike. For instance, if you're doing something on MSK,
Mm-hmm.
you're doing like how to differentiate between polymyalgia, polymyositis, and all those things, right? They present almost similar, but from their clinical presentation, lab
Yeah.
findings,
Mm,
those are where the discrepancy is falling. So
yeah.
sometimes you understand the pathophys, those intricate information that helps you because it helps you like pick out the diagnosis as fast as possible
As
before
possible. Yeah.
trying to choose management plan. So that was why I still use it sometimes. It's not like I'm doing the whole flashcard. No, I just pick out particular informations and just use them.
Yeah.
So thank you very much, Sekinat.
Thank you, Anthony.
See, let me be honest, right? I would love to have you back here in the future. If anybody would like us to bring back Sekinat, please just comment down below on the page. Just tell us to bring back Sekinat, to bring back Sekinat. If you have any questions you would like to ask Sekinat, please reach out to me. I'll reach out to her because she has a lot on her table. It's not easy being the coordinator and the president of the research
I
team
believe
of
so.
NAPI. Oh, accolade too much. Accolade, Boku is not easy. So she has a lot on her desk. She's currently doing her clinical rotations, and she's also preparing for her board. So if you notice, this is somebody who is, to be honest, engaged and finding time to come and interact and share her own understanding and her own experience so far with her journey towards becoming a medical doctor. I mean, I am so thankful for
Thank you.
finding time to come and relate with
Thank you
you.
for giving me fits
Yeah, I know, I
to be
know.
on your
All of them are they
platform.
fit. Everybody on this platform is always very fit. They are worthy. Like it's a process where we express. The platform is meant to help people starting the process to understand, while other people share their experience. There are people who have an experience and who would love for other persons to learn from it
Yeah.
and make their own path easier. I mean, my experience is different from your experience. Like I said, when I started, I was changing dollar at 143, 139. And you started when you were changing at 300. Where are we now? 1,600. So you see, the experience is totally different.
Crazy.
Somebody
Yeah.
starting now will be changing at 1,600. God forbid, it should just remain at
It should just stay
1,005.
like
Please, God forbid.
don't forbid it goes further, yeah.
Honestly. So we have different experiences, we have different timeline, um we have different exposure towards this process, and we handled it differently because I mean I have learned a lot on how you handle your own stress, and I'm also going to implement certain part of it to help me navigate my own process too. Thank you very much. Okay,
Thank
Sekinat.
you,
No,
Anthony.
Allah. I'll make sure I'll look for somewhere to cover the all expenses.
I'll treat I'll pay them.
Hey,
Oh, well, that was so good.
okay, thank you very much.
You're welcome.